Thank you so much for joining us. Our presenter, Iman, is highly experienced in scientific and regulatory affairs within the medical device and IVD industry. Just a few housekeeping items. Please remain muted with your camera off. Arazy Group members will be the only ones able to ask questions during the session. But if you do have questions, please note them down because we'll be setting up a follow-up email after the session where you can ask any questions that you have. And we will be recording the meeting, but unfortunately will not be able to distribute the recording after the session. So once again, thank you so much for being here. We are excited to get started. Thank you very much. Iman, over to you.
Thank you, Isabel. Yeah, so just want to remind you, so we will not share the recording, but we will be able to share the slides with you. So welcome to everyone in our meeting for March. It's really a pleasure to have all of you here together, both our internal participants from Arazy Group and all of these external guests. So today we'll be focusing on the latest regulatory updates in the following country: Argentina, Australia, Botswana, China, Egypt, Philippines, and Singapore, South Korea, Vietnam. In Argentina, there is an update of the fees for 2024. The table here displays the updated fee list published on the National Administration of Drug, Food and Medical Technology, ANMAT, as of January 10, 2024. It outlines prices for various procedures in Argentine pesos, categorized by risk class, as you can see. Specifically, it includes prices for product registration, license amendment, and license transfer for medical device and IVD of all classes. In Australia, our second country today, we review updates related to medical device labeling. So, last month, on February 19, 2024, the Therapeutic Goods Administration, TGA, took a significant step by publishing guidance on its website concerning medical device labeling obligation. So this guidance details the information that must be provided with a medical device for registration and outlines the obligations of manufacturer and sponsor regarding medical device labeling. This is specific to labeling. In Botswana, there is an update regarding the registration of medical device and IVD. So first, let me just remind you of the background information that we have already discussed and shared in a previous meeting regarding the registration of medical devices and IVD in Botswana. So on September 7, 2023, Botswana Medicine Regulatory Authority called BOMRA issued a public notice marking the commencement of a voluntary registration period for medical device and IVD. And this period spans from October 1st, 2023 to March 31st, 2024. Following this voluntary registration period, a mandatory registration period was supposed to commence from April 1st, 2024 onward. This registration, as we already discussed, concern medical devices and IVD that have been included in a priority list that is published on the BOMRA website. Now, in the current update that was published on February 16, the date for the voluntary registration was extended 3 months more to the 30th of June 2024, but not for all medical devices and IVD that were included in the priority list that was previously published in the BOMRA website. exclude all of these lists except the WHO pre-qualified IVD that are excluded from this extension. And as we can see, this WHO pre-qualified IVD test kits still subject to mandatory registration on the 1st of April, so in 2 weeks, without any extension of this new mandatory requirement in Botswana. And the link for the registration to the WHO pre-qualified IVD is available in Botswana website. And so the mandatory registration for all priority medical devices will be effective on 1st July 2024, as I said, except the IVD who qualified. So the application for the registration in Botswana will be received through this link. And any medical devices called for registration, in other words, like those that are included in the priority list, will be removed from the medical device listing register. So Botswana have a medical device listing register previous to all this regulation. So all of those devices that are joining the priority list will be removed from this listing from 1st January 2025. The next country, China. Okay. So in China, the updates concern medical device registration also and medical device industry standards. You know, a lot of things happened last year, 2023. That's why, as we can see here, on February 5th, 2024, the National Medical Product Administration, NMPA, released like a summary of all these news and updates during 2024, 2023, a medical device registration work report. So it provides valuable insights, and it is published on the website of NMPA. Here I will present the summary of all the relevant updates during 2023 that are stated in the report. So one of the key highlights of this report is the inclusion of the medical device management law in the legislative planning project by Standing Committee on the 14th National People Congress on September 8, 2023. Additionally, the State Food and Drug Administration has established a working group and expert advisory group to draft relevant legal tests in line with this new law. They are working on this new law. We don't know when it's going to be published, but they are working on this new law. And furthermore, the report detailed the issuance of 28 national standards for medical devices, already discussed about that in previous meeting, 131 industry standard and 14 industry standard modification orders. And we have already presented this information about the announcement of adjusting part of the classification catalog of medical devices that involve 58 products. So this is just a reminder that is summarized in this report. Also, the third batch of implementation of the UDI for medical devices, and finally, here there is analysis of the rates of medical device registration application acceptance in 2023 for different classes in China. And on February 19, 2024, the Chinese authority also released an announcement marking the approval of another 20 medical device industry standard. The annex of this announcement contain comprehensive information that include, as you can see in this table, standard number, name, scope of application, and implementation date for each standard. It's an important document. Next country, Egypt. So in Egypt, there are two updates that we'll be discussing: Me Device Electronic Platform Database and License Amendment. So first one concerning Me Device Electronic Platform Database on February 28, 2024, the last month, Egyptian Medicine Authority made an important announcement regarding the updates of this electronic platform. So this update includes names of medical devices in IVD and the production input component along with their respective category. The primary objective behind this update is to facilitate the process of submitting registration, application, and import approval as well. So next update on Egypt concerns the license amendments. On last December, the Egyptian Medical Authority issued update guideline for the license amendment procedure for registered medical devices. This guideline became effective on the same date, so December 11, 2023, so it supersedes the initial version that was published on 2021. There are the updated timelines and procedure for the license amendment process. After submission, the first step, called file check-in, now has defined timeline for both normal and fast track process. For the normal track, it takes 8 working days, while for the fast track, it's expedited to 5 working days. So, as a reminder, previously the evaluation period for both track, I mean, it was not specified whether it is for normal or fast track, but previously the evaluation period was 3 to 5 days. Now, the second step for file evaluation, it has updated the timelines to 24 working days for normal track and 10 working days for fast track. And also there is a new information regarding requirement for case study dossier. Okay. So in Philippines, the updates that we will go through concern initial and renewal application process. On January 2024, the FDA Philippines issued advisory to all the medical device establishments seeking product authorization for medical devices. So the advisory outlined a significant revision in the application process for the Certificate of Medical Device Registration, known as CMDR, and the CMDN for initial submission and renewal. So under the new directive, what is new? What is the update? The applicant company are granted now one-time compliance opportunity to rectify and submit any deficiency identified during the application review. And the failure to do so within the specified time frame would result in the application being considered disapproved. However, the advisory allows for reapplication for a disapproved submission, provided it is made within 60 calendar days for initial application and 30 days for renewal from the date of disapproval. This reapplication incurs additional fees and should include the notification of deficiency and the necessary document to address all noted deficiency. Okay. Next country, Singapore. So navigating through the updates in Singapore, we have 2 regulatory updates to discuss: medical device product registration and product registration using Asian CSDT. Okay. So the medicine device guidance GN 15, titled Guidance on Medical Device Product Registration, has recently undergone its 10th revision as of January 24, 2024. But furthermore, short after, on March 1st, the guidance has undergone its 11th revision. So here we are going to present summary of both updates. The key updates in this revision mainly focus on first, eligibility criteria within specific evaluation routes, notably for the immediate Class B registration and the expedited Class C registration evaluation route, a device must now not only obtain approval from at least one of the HAS independent reference regulatory agency, but also have to be marketed for a minimum of 3 years in this reference agency. So this is the main update regarding these two evaluation routes. Secondly, introducing critical updates in Annex 5 and 7, which outlines submission requirement for Class B, C, and D. It has been specified that traceability analysis is only mandatory for the full evaluation routes for Class B, C, and D medical devices. In addition, it is worthy to note that the following templates have been updated and are available on the HAS website. Letter of authorization template, marketing history declaration template, and safety declaration template. So to update our records. Next update in Singapore. Um, So the GN17 R3 and GN18 R3 guidance on preparation of product registration submission for medical device and IVD using Asian CSDT and the TR01 R3 contents of a product registration submission for GMD using the Asian CSDT. The third revision were published on March 1st, 2024. Under the submission requirement section, in this guidance, we go through the submission requirement section. There were some addition. So notably for device description requirement for both MD and IVD, we have the following that was added. The summary of the software development lifecycle from software development to software maintenance and the process that are in place to manage the various lifecycle activity. The software requirement specification that documents functional performance interface design developmental and other requirements for the software should be provided. So all this should be provided in the description requirement. As I said, summary of the software from development lifecycle, and this software requirement specification that document functional performance interface, design, developmental, and other requirements for the software. So this document, this description, this is for it basically said what the device is supposed to do. And also, it is mentioned that software verification and validation study are now required, but the guidelines specify it only for medical device. So this is related to traceability analysis, linking product design requirement, design specification, and testing requirement. So this is the addition that we have in the submission requirement, as I said, for device description and for these tests. In South Korea, The fees, again, the fees for initial and amendment application were updated. So this was published on January 17, 2024. The NIDS issued this announcement regarding changes in the technical document review fees and submission method. The document specify an increase in fees. So this is, as you can see in the table, the difference between the previous fees and this updated fee, it's a huge increase. This is concern class 2 medical devices. The authority outlines that by increasing those fees in this highly elevated amount, they aim to speed the review, and it is expected to be like a 10% reduction in complaint processing period. In addition, it is possible to submit. So as I said in this announcement or this notification, they have published this updated fees and also submission method. Submission method, it is possible now to submit for technical document review in this link. Medical device electronic civil complaint system. This is how it is called. Okay, I think this is the last country for today, Vietnam. So we have two crucial updates in Vietnam, or reminder. CLDG for the registration of Class C and D devices, and certificate of clinical test results. So starting from January, yes, this is a reminder, starting from January 1st, the Asian Common Submission Dossier, CLDG, is started to be required for the registration of Class C and D devices. According to the regulation that was already published, the Decree 98/2021 and the Decree 07/2023. So please note that the fast-track routes do not necessitate review by the National Institute, and the standard routes does require National Institute review, as outlined here below. The Institute of Medical Device and Construction reviews CLDT for general medical devices, and the National Institute for Control of Vaccines and Biologicals reviews CLDT for IVD. And on the 30th of December 2023, the Authority of Vietnam issued the Decree 96/2023 on medical device management. So starting on 1st January 20, this is, we still have a lot of time, but 2026, a certificate of clinical test results from a competent authority will be required to register Class C and D medical devices that are subjected to clinical testing. Important to highlight this. So please note that the following medical devices do not require clinical tests in Vietnam: Class AB and Class CD medical devices approved for circulation by the Ministry of Health of Vietnam or a competent foreign agency. Yeah, we reached the summary. So I'm gonna give you a summary of all the updates that we have discussed today. We covered information from 9 countries: Argentina, Australia, Botswana, China, Egypt, Philippines, Singapore, South Korea, and Vietnam. So in Argentina, the focus was on the fees of the year 2024. In Australia, the updates involved medical device labeling, which was published on the Australia website, competent authority website, TGA. Botswana addresses the registration of medical device and IVD, so the extension date, which devices are concerned by this extension, and the new voluntary date which devices are concerned. Sorry. In China, provide updates on medical device registration industry standards. So we reviewed the report for 2023 that was published by the NMPA that includes several updates that happened on 2023. The job they are processing now for the new law, the industry standards that were recently published. Um, in Egypt, introduced the update to the Mi device electronic platform, and all the updates for the license amendment procedure, the updated timelines in different steps. The Philippines that presents information on initial renewal application process. Singapore, we discussed medical device product registration and Asian CSDG. The South Korea focuses on initial and amendment application fee again. And finally, Vietnam provides updates on CSDG or reminder for the registration of Class C and D, as well as the certificates of clinical test results. So as I said, in Vietnam, I think it started from the 1st of January, but they have also published on their website that they have some interruption in the service, the online service for registration. Maybe it is recovered for now, but they have some issue. Even if it started 1st January, which should be established soon. Thank you all for your assistance today. And yeah, please, for Arazy member, do you have any question, another clarification? And for our guests, as Isabel said at the beginning of this session, you can always send us your question, and we can answer. We are pleased to answer to all of this question. Thank you. Yes, Eden. Yeah, so Eden he just write the question. The question from Eden is regarding Egypt. They say, what are you referring to with case study dossier in Egypt? Okay, yes, as I said in Egypt, let me just come back to the slides. I think the second one, yes. So yeah, they have added, I said they have added in this update the requirement for case study dossier. So this is basically modification that are not specified in the guideline, and they're minor or major modification type list. So there are like a major modification, they specify what is it about the main minor modification, and any other modification that is not included in the list of minor or major modification, it is called like case study dossier, case by case. So here they have added this section with all the requirement for this case study. Hope I answered. Yes. Yeah. Thank you, Aidan. Any other question? Yeah. Yes. Yes, I think I heard, but I can't see the message. Who? Yeah, please. Edit. Yeah.
Hi, man. Thank you for the presentation. I
You're
have a
welcome.
question about Botswana.
Yes.
I wasn't sure, are there any fees for the registration of the medical device in Botswana and IVDs as well?
Okay. Yeah, of course. Let me just look for the. Yes. So there are fees, and they are already published on their because before of the applicability of all these voluntary and mandatory dates, and they had already published a regulation on 2019, like years before, and they have published the fees, applicable fee for the when the registration times come, and they didn't change it. So this is the applicable fee. This would be the applicable fee. And so the BOMRA website, there are a lot of information published, including this regulation, where you can find more details about the requirement, the fees. And by the way, this regulation also specify the timelines for each process, and also this it's specified that uh, all these listed medical devices in IVD that are, I mean, listed, so they are they were listed before the applicability of this laws, like kind of permit to be marketed, not the registration, but kind of permit. So these medical devices will be also subject to retention fee, even if they are not registered. It is not mandatory to register them. They will be subject to retention fee for the that will come for the next year on 2025. So the first month of the next year. Yeah.
Okay. I will check the website as well. Thank you, Iman.
You're welcome, Adi. Yeah. I think, if there's no more question, we'll finish our session for today. And please, guests, you can always send us your question, and we'll provide you with the slides that summarize all this information. Thank you for all of you, and I'll see you hopefully on the next month for with more information. Bye for
Awesome.
now.
Thank you, Aman. Take care, everyone. Thanks for coming.